Welcome back. This section of the show is called Ask FPA. You can send your medical questions to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is, my mom says that chicken noodle soup and Gatorade help a cold. Is that really true? Asked by Taylor of Nicholasville, Kentucky. Now here to answer some food questions is Erin Casey, our registered dietitian at Family Practice Associates. But I'll try to take a stab at the chicken noodle soup question. Okay,
Sounds
I mean,
good.
it does help thin your secretions.
It does.
The salt and the warmth helps your throat, and there's some anecdotal evidence that it might be a little anti-inflammatory. So yeah, it makes you feel better. And food helps do a lot of things.
Yes,
But we're
it
coming up on the holidays. We're going to be a lot of overeating.
Yes.
Is there a healthy way to eat?
There is. The advice I give everybody is just kind of do things in moderation. So particularly when it comes to the holidays and there's kind of all of that really rich, delicious food around, you don't want to exclude yourself from it because then you're really missing out on half of the celebration. So I like to advise kind of what I call the flyby effect, which is if you've got a buffet or a spread of food, walk by the buffet table initially without taking any food, kind of survey your options basically, and then go back and take a second lap, and then with that kind of pick and choose the foods that you really want to try. It's not that you can't indulge, it's just indulge in moderate portions. And you certainly eat those favorite holiday foods, but do so in moderation.
Well, I use the term healthy diet. Tell us what is a healthy diet? Is there a way to describe that?
Yeah, so a healthy diet will look different for everyone. There's really no concrete eat this, don't eat this list that works for everybody. Unfortunately, it's just not that simple. But generally speaking, it comes down to balance. For most people, it's eating a balance of different food groups and making sure that you're kind of rotating through those fruits and vegetables. Particularly, they tend to be really high in antioxidants. They're lower in calories. So they kind of tend to beef up your diet and give you all the good stuff that you want without added processed stuff that you don't. So.
Now, a dietitian can help you with a healthy diet.
Yes.
And there's a difference between a dietitian and a nutritionist, or is there?
Yes, there is. So a registered dietitian is somebody very similar to a registered nurse. So a registered dietitian has gone through a minimum of a bachelor's degree of education and then undergone at least 1,200 hours of supervised practice and passed a national certification exam. A nutritionist can really be anything less. Really, anyone can call themselves a nutritionist, whether they've had any real training or not. Whereas a dietitian, there's extreme clinical training, and then there's also, a certification board that kind of keeps us accountable as well. So we're clinical practitioners. We can bill through insurance. We're also held accountable by a board of practitioners as well.
Now, you mentioned insurance. There are some things, a dietitian, that the insurance will help cover?
Absolutely. Particularly in Kentucky, Medicare covers diabetes, medical nutrition therapy very, very well. It also will cover medical nutrition therapy for chronic kidney disease as well. Some insurance policies will also cover things like weight management, GI diseases, food allergies, but a lot of that will kind of vary depending on your insurance carrier and on your specific policy.
We talked a little bit about a healthy diet. There's a lot of fad diets out there. I mean, Atkins diet, all kinds of things.
Yes.
Good, bad, or individual?
So I personally will not advocate for any of them. If a patient comes to me and tells me I want to follow this ketogenic diet, for example, what are some foods that I can eat? I will work within their parameters, but I will always give them kind of the full picture. Most fad diets approach typically weight loss, but some type of health outcome by making drastic changes that really are not sustainable for a long period of time. So as a dietitian, my goal is to help my patients develop healthy habits for the long haul. So short-term goals, short-term drastic changes are never my go-to practice. I'm much more concerned with having them help develop the healthy habits that they're going to serve them well in the long run.
Well, I always, people ask me about the diets a lot, and sometimes I'll say, okay, if you want to start a diet, you can, but you can't live a life like that.
No, you can't.
You've got to learn to eat for a lifetime.
Right, because typically, more often than not, people are trying to lose weight with a fad diet, and whether they're losing weight because they just want to look better and feel better, or sometimes they're trying to lose weight because they think it will affect other chronic conditions such as heart disease, diabetes, risk factors for other things like metabolic syndrome. And all of that is true. Weight loss certainly can help prevent some of those diseases. That said, doing it in such a way where you make a drastic change and lose a lot of weight very quickly actually isn't helpful. You want to have that well-balanced, healthy lifestyle for the long run, because those chronic conditions certainly don't develop overnight, and they're not going to be magically fixed by losing 30 pounds in 2 months. You really want that healthier, slow and steady, moderation lifestyle.
Good diet.
Yes.
Thanks for coming in, and watch your diet this holiday season. We'll be right back.